Hi everybody. Once again, welcome to another series of anatomy videos. And today we're going to look at we're continuing to look, going with the osteology course. And today we'll be discussing one of the important bones of the lower limb, which is the femur. And femur is one of the important bones of the lower limb. Okay, so this is the femur here, all right? So we're going to look at that in details a bit later. We're going to zoom in and look at the protrusions and external features of this bone. And before that, let me just give you a brief general information about the femur, in that it is, as you can see, it is a long bone, all right? And it is one of the strongest and heaviest bone in the body. Okay, so it is really strong and it is really heavy. And the reason why it is that to carry most of the weight of the body. And in terms of when I say carrying the weight, basically it has two joints or two connections or two articulations in the proximal side and in the distal lower side. In the proximal aspect, the femur is connected with the pelvic bone via the hip joint. So we looked at that in our previous video. We have the head of the femur articulates with the acetabulum of the pelvic bone, forming the hip joint. So basically what happens is that the weight of the axial skeletal, or the weight of the upper limb, passes through the pelvic girdle of the pelvic bone through this hip joint, and it is then transmitted to the femur. So femur basically are able to carry all those weight of the upper limb, and from the femur it is then passed on to the leg via the knee joint. We're going to look at the knee joint again a bit later. So we have two joints, two articulations. In the proximal side, we have the hip joint, okay, with the pelvic bone and the femur. And then we have at the distal end, we have another joint, which is the knee joint. And basically the knee joint is formed by the femur, the condyles of the femur, and the condyles of the tibia, and also one other small bone, which is the sesamoid bone, that also contributes with the knee joint, which is called the patella. So we have the patella, the distal portion of the femur, and the proximal portion of the tibia. Basically, together, all these three bones or three bony components come together, what we call as the knee joint. So this is where it stands, the femur. And as you can see, I don't know if you can see it directly. If you see it directly, the femur is like, it's medially directed. So it's not really straight position, as you can see in the human body. It's slightly medially. So this is the right femur, and basically this is the left femur. As you can see, the orientation, the line would be medially diverted. So the femur on either side, it's like medially constricted or medially diverted angle in the anatomical position. Okay, and there are a various amount of muscular attachments on this bone, and we have, so in the frontal aspect we have the quadriceps. Okay, we have the quadriceps, and at the back we have the hamstring muscles, and basically, and also we have muscles on the posterior aspect of the pelvis, also attaches to the posterior aspect of the femur. And by the way, when we talk about femur, this area here is called the thigh, by the way, okay? So it is also called the thigh bone. So the bone that is located in the thigh is the femur. So we have the quadricep at the front, we have the hamstrings at the back, and then we have the some of the muscles from the posterior aspect of the pelvic bone attaches to the posterior aspect of the femur, and that basically has an important external rotator function of the femur. And then we have the adductor compartment, the medial compartment, which is this, the medial part of the femur. So attaches to the medial side of the femur, and thus adducts, moves the femur towards the body. So basically, what happens? Let me show you the motions around the hip joint. So we have, so this motion here is the flexion. Okay, so this is the flexion. All right, this is the extension of the hip joint, flexion of the hip joint. All right, this is the abduction, moving out from the from the midline, and coming back to its original position is the adduction. So abduction, adduction, flexion, extension, and lateral rotation slightly, lateral rotation, and then we have the medial rotation. Okay, so medial rotation slightly, lateral rotation, medial rotation, and all these motions come together. We have a circumduction motion. So let me show you on my body. So we have, so this is the hip joint here. So we have the flexion of the femur of the hip joint. Okay, so this is the flexion, and going back is the extension of the femur of the hip joint. Flexion, extension, and then we have abduction, right? Abduction, and coming back towards the midline is the adduction. External rotation, internal rotation. Okay, external rotation, internal rotation, and then we have the circumduction motion. That does the circular motion of the hip joint. So all these basically are done via the hip joint. So basically this is also referred to as the ball and socket type of joint. And because of the formation of the structure of the femur head and the socket of the acetabulum allows all these particular movements and motions. Okay, so you have the flexion, extension, and adduction, lateral rotation, medial rotation, or external rotation, internal rotation, and then we have the circumduction motion. Now, all these done via the actions of the muscles that attaches to the femur in certain areas, and we're going to look at that a bit later again. Okay, so that's femur. Okay, so let's look at now. Let's look at. All right, let's look at the femur down and zoom in and look at the general features of the femur. One other thing before zooming in. One other thing is that when we look at the side determination, I'm going to show you that in a closer view. But before that, by looking at it from a far view, what we see here, as you can see, so this is the right femur, and basically this is the left femur, or right upper limb, and the left upper limb. So this is the right femur. The reason why we say this is right is that we look at the head of the femur, as you can see. The head of the femur is medially located, all right, as you can see. However, in the left femur, again, the head of the femur is also medially located. So it has to be medially located, the head of the femur. It's one criteria. And the second criteria, we're going to look at it. There's a bent or arch that faces forward. The convex side or the surface faces forward. There's a bent forward of the femur on the anterior aspect. And second and third, most importantly, is that at the back of the femur, I'm going to show you that there's a rigid, straight, sharp border, and this is called linea aspera. And linea aspera is always located on the posterior side. So as you can see on the anterior side, it's smooth. Okay, so all these, we have these surfaces, we have the borders, and it's not that sharp, so it's not that evident, but primarily we have this smooth surface on the anterior side. However, on the posterior side, I'm going to show you that, okay, on the posterior side, I don't know if you can see it, but however, so this is So this is the posterior side here. It's sharp and there's a ridge. So this is always located on the posterior side. Okay, so it has to be like this. So let's determine the side of this femur in my hand. So the head of the femur should be medially located. So it has to be like this, right? Or it could be located like this, because it's also medial. But second criteria, the linea aspera should be on the posterior aspect. So this is a sharp edge, as you can see, the sharp border, and this is located on the posterior aspect. This is called the linea aspera. It has to be posterior located. So when I do this, so this is the head of the femur is medially located. That's one. The second criteria, the sharp edge is located on the posterior side. All right. So basically, this femur is left femur. Okay. So the head of the femur, medially located, and linea aspera, the sharp edge of the linea aspera, is posterior located. All right. So these two criteria make up an important classification of features to determine the femur whether it's right or left. Okay, so that's about it. So let's look at the femur in detail and zoom in and look at the detailed features. Okay, let's start. Yes, so this is the femur, as you can see. So basically, like I said, this is the strongest, heaviest, and the longest bone of the human body. And it has the proximal end, shaft, and the distal end. So this is the proximal end, this is the shaft, and this is the distal end of the femur. Again, this bone, as you can see, it resembles one of the other bone of the upper limb, as you can imagine. And if you look at it carefully, it looks similar to the humerus. It has this round head on the proximal edge. Okay, so this is, and other important thing to remember is when you look at the side view. Okay, this is the side of the femur, so it's arched anteriorly. As you can see, it's not straight. It's partially arched anteriorly or convex anteriorly. Okay, it's like bent, as you can see, anteriorly. So this is one of the features of the femur, and it's really strong. The shaft is really thick and strong and heavy, especially the shaft of the femur. And okay, so this is how it looks like, as we can see. All right, so this is the proximal end. So this is the proximal end, and this is the shaft, and this is distal end, like I told you earlier. So let's look at the proximal end now in details. And before that, so this is the anterior aspect of the femur, and this is the posterior aspect of the femur. So anterior aspect, so you have the bend on the anterior surface, and on the posterior aspect, the thing that we see here on the posterior aspect. So on the proximal end, we have these prominences, bony prominences, and sticking out, bumping out, and these are called trochanter. So we have the greater trochanter, lesser trochanter. So we're going to look at that, and then we have this linea aspera, this ridge, the bony ridge on the posterior aspect. Okay, so this is the posterior aspect of the femur, and this is the anterior aspect. The anterior aspect, greater and lesser trochanter, we can see prominences. The bony protrusions it's less evident. So if we look at that from the back view, these trochanters are full evident features of the proximal part of the femur, greater and lesser trochanter. Okay, so this is the proximal end. The first important thing that we see here is the head of the femur. So this is the head. It's a circular structure, and it has this is the articular surface. Okay, so we have the cartilage that surrounds the hyaline cartilage that is in contact with this articular surface, and basically this head articulates with the acetabulum of the pelvic bone, like so. I'm sorry, like this, like so. So this is the acetabulum of the pelvic bone, and it's the head of the femur, and they form the what we call as the hip joint. Okay, so this is the hip joint that forms between these two important bones. One thing that we see here is on in the head, we have this fovea or depression, what we call as fovea capitis. This fovea capitis is really important in that you have a ligament passing through this fovea or this pit, and this ligament is called the ligament of the head of the femur. And it has a variety, well, it has a couple of names actually, according to different sources. So we have ligament of the head of the femur, that's one. The second, it is also referred to as the ligamentum teres femoris, and it is also referred to as round ligament. So we have, three, or the ligament of fovea capitis. So we have like 4 names of this ligament, but no big deal. What I use is the ligament of the head of the femur. That's what I use. So this ligament of the head of the femur passes through the head, and one of the important aspects of this ligament is that inside this ligament there is an artery, there is a branch. There's an arterial branch that comes off from the obturator artery. It's a branch of obturator artery. Okay, so this ligament, basically, if you look at the acetabulum, so this ligament attaches to this acetabular fossa, and also to the edges of this notch here. So this is the acetabular notch, as you can, if you can recall in our previous videos. So this acetabulum had this notch here, and this is called the acetabular notch, and then we have the ligament, the transverse acetabular ligament. And basically this ligament, the ligament of the head of the femur, attaches to this fossa and then goes all the way down to the edges of the notch, and also attaches to the transverse acetabular ligament. So basically it goes all the way in this direction. So this ligament, although it is referred to as ligament, attaching bone to bone, but however, the primary function of this ligament is to carry this important arterial branch. And this arterial branch basically passes through this acetabular foramen. And this is the branch, like I said, coming off from obturator artery. So obturator artery is somewhere around here. It gives us a branch and then goes in, pierces the tendon. Okay, it goes through the tendon, and through this tendon, it goes through the head. It goes inside the head of the femur to supply this particular area. So this branch basically supplies the epiphyseal cartilage. So in the development of the femur, the head of the femur, the neck, so in between you have the epiphyseal plate, and epiphyseal plate is important in longitudinal growth of the long bones. So it supplies the epiphyseal plate plus the head of the femur. But later on, after a certain age, the epiphyseal plate, if you recall, epiphyseal plate after 20 years old, it ossifies. It becomes a bony part on the area. So, and then you don't have any cartilaginous portion, so you don't need a supply for that. So basically, what happens? This artery goes under necrosis, and it doesn't supply this area anymore. So you have an additional supply from the medial circumflex femoral artery that comes off from the femoral artery. So we have another blood supply that supplies the neck, and that basically supplies the head. However, in a clinical, just one clinical note, when there's a fracture of the femur, of the neck of the femur, which is the fracture passing through this area, so normally then the artery that supplies the neck also supplies the head after a certain age, like I said. So if there's a fracture, so there's a elimination of the supply of the blood to the head. So after a certain age, the head of the femur gets a decreased amount of blood supply. Hence, you have the increased amount of osteoporosis, and low mineral density, and therefore, especially when after a certain age, it gets prone to damage and fracture after a certain age because of this clinical situation. Okay, so that's the head, fovea capitis. So this is the head of the femur. Okay, so let's get to the next portion. It would be the neck of the femur, this is the neck. All right. This is the posterior aspect of the neck, and this is the anterior aspect of the neck.
and the neck basically connects the head to the shaft. Connects the head to the shaft. All right, and again, another clinical note is that one of the important aspects that the femur gets fractured is the neck of the femur. So this is the area where most fractures occur. Why? Because most of the weight is vulnerable as it passes, as it's being transmitted from the hip to the knee. It is transferred through the neck, and the neck is again the most vulnerable area of the femur. So this area gets fractured. So when you hear a person who received a hip fracture, what they mean is that there's no breakage of the bone of the pelvic girdle or the pelvic bones. What you do see is the fracture of the neck of the femur. So the fracture really occurs in the neck when you have a hip fracture. Okay, so this is the neck of the femur. All right. This is the anterior view. This is the posterior view. Okay, next, this is the posterior view. Let's continue on the posterior view. The next we have these protrusions of bony particles, which is the trochanterus. This is the greater trochanter. This is the lesser trochanter. And in between, we have a crest, and this crest is called the intratrochanteric crest. All right. So this is the intratrochanteric crest, greater trochanter, lesser trochanter, and just above the going towards the greater trochanter, we have a tubercle here. This is called the quadrate tubercle. Okay. So greater trochanter, lesser trochanter, intratrochanteric crest. All right. Just next to the greater trochanter, we have a tubercle here, what we call as the greater. We have the quadrate tubercle, and quadrate tubercle is an important area where the quadrate muscles, the quadrate muscle attaches to this area. So quadrate muscle is basically is located at the back of the pelvic bone. So we have the quadrate muscle coming in and attaches to this particular area. Okay, so this is the quadrate tubercle. If we look at on the anterior side, okay, so we have the view of the anterior side. We have the greater trochanter, lesser trochanterus behind, and between we have a line, what we call as intertrochanteric line. So we have the trochanteric, the crest, intertrochanteric crest, and we have the intertrochanteric line. So there's a line here, and there's a crest at the back. So we're talking about the crest at the back. At the front, we have the line. Okay, and these are basically attachment points for certain muscles. All right. So the greater trochanter, as you can see, this is the greater trochanter here. All right. Just on the medial surface of the greater trochanter, on the medial surface, there's a fossa here, a notch. Okay, so we have the a trochanteric fossa, and this trochanteric fossa basically serves as attachment to the to what we call as the obturator externus muscle. So this is obturator externus muscle attaches to this area here, and let me show you a couple of muscles. Hold on. So we have, like I said, just wanted to show you a couple of muscle attachments to that particular area. So to just get you familiar with certain muscular attachments. So we have this acetabular fossa here. Like I said, the external obturator muscle attaches to this area here. So we have the certain muscles on the posterior aspect of the pelvis. We have the so this is the gluteus maximus. Okay, so this is the gluteus maximus. This is the gluteus medius here, and this is the gluteus minimus muscle. And then we have these muscles here. All these muscles basically attaches to the femur. Okay, so this basically, when they attach to the femur, basically it does this motion here. It pulls the femur towards itself. So this is basically external rotation. And some of the, like gluteus medius and minimus, attaches to this area, and they pull the femur towards the body, and they adduct. Like in terms of gluteus maximus, we're going to talk about that. It pulls it in this direction. It extends the femur. Basically, my point here is that you have the muscular attachment to the femur, and basically you have wide motions. We have the either abduction, external rotation, adduction, and extension motion because of detachment points. So what do we have here? So we have the here is the trochanteric fossa. So we have the external oblique muscle tendon attaches here, and just above that we have the internal. We have the piriformis muscle. This is the piriformis muscle. This is the gemellus superior. This is the obturator internus, gemellus inferior. This is quadratus femoris. Remember, I talked about there's a quadrate tubercle here. So this is the quadrate muscle here. So quadrate muscle basically comes in and attaches to this area. When it pulls it, so basically you have the external rotation of the femur, okay? And then we have the gluteus medius and minimus. Gluteus medius and minimus basically attaches to this greater trochanter, all right? And basically these muscle pulls, and you have the adduction of the femur. And one of the important, just beneath in the shaft, just beneath the greater and lesser trochanter, we're going to look at that. Just around here we have gluteal tuberosity. Okay, so gluteal tuberosity, the gluteus maximus, which is this muscle here. Okay, so this muscle here is the gluteus maximus, basically attaches to this area here. This is the gluteal tuberosity. All right. So basically, when it pulls, when the gluteus maximus pulls this area, it extends the femur. All right. It does this motion here. So this is the gluteal tuberosity. All right. And this is the greater trochanter, and then we have the gluteus. Okay, so let's look at it in detail now. Okay. Like I said a second ago, so we have the greater trochanter and muscle attachment to the greater trochanter. We have just a recap. So we have the gluteus medius, gluteus minimus, and then we have the external rotator muscles, which is the external obturator. We have the internal obturator. We have the two gemelli, superior inferior gemellus, and then we have the quadrate tubercle, the quadratus muscle. Basically, all these muscles either externally rotate the thigh, or adduct the thigh. And then one other thing would be the gluteal tuberosity. This is the gluteal tuberosity here on the posterior side. So gluteus maximus attaches to this area here, and basically extending and do this extension motion of the femur. So this is the proximal end of the femur. Let's look at the shaft now. Okay, this is the shaft. Like I said, it has a slight bend forward, arched forward. Okay, and it has three surfaces and three borders. I'm not going to go over these surfaces and borders, but one of the important borders that we need to know is the posterior border, which is this border here. This posterior border, as you can see, it's sharp, and this posterior border is called the linea aspera. Linea aspera has two lips, the medial lip and lateral lip, as you can see. And okay, I'll just put it over here like this so you can focus it. So this is the linea aspera. So you have the medial lip and the lateral lip. All right. So medial lip, lateral lip, as you can see, it goes upwards to the proximal end, towards the proximal. It passes on the lateral side of the gluteal tuberosity, and then goes all the way to the great trochanter. The medial lip, however, it goes upwards, and it passes through this. I don't know if you can differentiate it. There's a line here. This is called the pectineal line, or the spiral line, and this spiral line goes upwards and connects with the intertrochanteric line on the anterior surface. So this was the intertrochanteric line, all right, on the anterior surface. So, and below that you would see the spiral line or the gluteal line. So this gluteal line is basically where the gluteus muscle, the gluteus muscle. You remember we talked about the pecten gluten, pecten line, pecten pubis. I'm sorry, pecten pubis. The pecten on the pecten pubis on the pubic bone of the pelvic and the pelvis. So we have the pectineus muscle emerges from that area to this area here. Okay, so basically it adducts the femur, it pulls the femur towards itself. So we have the pectineal line, we have the gluteal tuberosity here. So this continues down with the along with the medial lip, it forms a medial lip, and then we have the lateral lip, and then we have the the area between the medial and lateral lip of the linea aspera. Now, linea aspera, as it goes down, as you can see, it goes down. The medial lip goes down and forms the medial supracondylar here. It goes down and forms a medial supracondylar line. In some sources, this is also referred to as ridge, just like the humerus. But we don't call it as a ridge because it doesn't feel like a ridge. So okay, so it is referred as a line. So this is the supracondylar line, and then lateral lip, as it goes down to the distal end of the femur, it forms the lateral supracondylar line. So this is the lateral supracondylar line, and this is the medial supracondylar line. In between these two lines, we have the popliteal fossa. So this is basically the distal end, distal part of the femur. Okay, so this is the popliteal fossa, and so this is the medial supracondylar line. How do I know this is the medial? Why? Because the head. Okay, this is the head side. This is the head of the femur. This is the medial side. So this is the medial supracondylar line, and this is the lateral supracondylar line. And as the line goes downwards, you have the epicondyle. So we have the medial epicondyle on the medial side, and on the lateral side, this protrusion is called the lateral epicondyle. Lateral epicondyle and medial epicondyle. So that's basically the shaft, and basically the linea aspera is the important ridge of the posterior aspect of the femur and serves attachment to, again, a lot of muscles and this is basically the posterior aspect of the femur, and the posterior aspect of the femur has the hamstring muscles, and also we have the quadriceps on the anterior aspect. Okay, we have the quadriceps muscle, but still we have the vastus medialis, vastus lateralis, also attaches on the anterior side, and also on the lips of the linea aspera. It has a wide range of attachment, the quadriceps femoris. So basically, and also this linea aspera serves attachment to the adductors, adductors like adductor brevis, adductor longus, and adductor magnus. We're going to look at that in detail in a muscular course. So we have adductor muscles that adducts, moves the femur towards the body. So they attach, they come from the pelvic bone and attach to this linea aspera, all right, and when they contract, they pull the femur towards the body, and you have the adduction of the thigh. So we have the adductor muscles, and then we have the vastus lateralis, vastus medialis, and and then we have over here on the upper part of the posterior area of the femur, we have the gluteal tuberosity, where gluteus maximus attaches to this particular area. So this is basically the shaft. Okay, so the important thing that you need to remember is that the posterior aspect of the shaft of the femur is comprised by this sharp ridge of bone, which is mostly pronounced at the medial third of the femur, and it's called the linea aspera. Okay, let's look at the distal part of the femur now. Okay, so this is the distal part of the femur. So what we see at the distal part of the femur is these condyles. Condyle means knuckles. Okay, it's like knuckles of the fist. It means knuckles, condyles, and this is basically, it forms an articulation with the tibia, forming the condylar type of joints, condylar type of synovial joint. So this is basically how it connects with the tibia. Okay, so this is basically the condyles of the tibia, and these are the condyles of the femur. All right. So if we go into specifically, so we have So this is the medial part. So this is the head. Okay, so this is the medial. This is the medial condyle, and this is the lateral condyle. All right. So this is the distal part of the femur. And in the distal part of the femur, as you can see, the condyles, we have the anterior surface of the condyle, we have the inferior surface, and then we have the posterior surface. So this is the posterior surface, as you can see. This is the posterior surface, this is the inferior surface, and this is the anterior surface of the condyle. All right, medial condyle, lateral condyle. And let's look at these. And then on the posterior surface, between the two condyles, we have the fossa, a notch, and this is called the intercondylar fossa. And the intercondylar fossa is really important in attachment of some of the ligaments that we're going to look at. We're going to look at it a bit later. So this is the intercondylar fossa on the posterior aspect. Okay, so and these condyles basically attaches with other bones that are articulates. So one of the bones on the anterior aspect, we have this facet, this condyle articulates or attaches with the patellar. Okay, so this is the patellar here. Okay, so this is the patella, and so this is it has the articular facet where patella attaches to, and so patellar has a lateral articular facet. Okay, let's look at patella. So patella has a medial articular facet. Sorry, let me look at here. So this is the medial. So we have the medial articular facet, and then we have the lateral articular facet. So the medial articular facet attaches to the medial part of medial condyle, and the lateral articular facet attaches to the lateral condyle. Simple. And basically this here is the patellar surface. Okay, so it articulates with the patella over here, like so. Okay, so, and therefore the joint between the femur and patella forms the patellofemoral joint. And patellofemoral joint basically is basically part of the knee joint. Okay, the next joint would be the tibiofemoral joint, which is basically, again, a condylar type of synovial joint, and you have again, if you look at the tibia, so this is the tibia here, and then you have the tibia also has these condylar surfaces, again, medial condyle and lateral condyle of the femur, of the tibia. The reason why I said this is, how do I know this is lateral, this is medial, because that you have this fibula attached to the tibia. Fibula, again, this is the leg, all right, this is the leg bone, and tibia is the shin bone, it's also called the shin bone. And tibia is always located on the medial aspect. However, the fibula is always located on the lateral aspect, just like the forearm. The ulnar is medial located, the radius is lateral located, and the leg, again, the fibula, all right, this thin bone is fibula, it is lateral located, and the tibia is medial located. Therefore, if you look at the condyles, so we have this is the medial tibial condyle, or medial condyle of the tibia, and this is the lateral condyle of the tibia. So basically, these condyles articulate with the condyles of the femur. Very simple, like so. Okay, so the medial condyle of the femur articulates with the medial condyle of the tibia. I'm sorry. And lateral condyle of the tibia articulates with the lateral condyle of the tibia. The lateral condyle of the femur articulates with the lateral condyle of the tibia. That's so simple. So basically, so what do we have here? We have a tibial-femoral joint. So we have two aspects of tibial-femoral joint. Basically, it is also referred to as medial and lateral. So we have the medial. So we have the medial tibial-femoral medial tibio-femoral joint, and then we have the lateral tibio-femoral joint. And basically, we don't have to divide this into two categories like this. And basically, we can basically say that this is basically the tibio-femoral joint collectively. So we have two connections or joint here between the tibia and the femur, and between the patella and the femur. So basically, these two joints between the femur and tibia and the femur and the patella make up the knee joint. All right. So we have two different joints that make up the knee joint, and this basically makes the knee joint a really a complex joint of the human body. And we're going to look at this. So basically, this condylar type of joint, as you can see, these condyles basically slides on each other, forming the flexion and extension motion. So this is the flexion and extension motion of the knee joint. Okay. And it also has slight medial and lateral rotation. Okay, very slight medial lateral rotation, but primarily it does the extension and flexion motions. Okay, so it does this flexion, extension, all right? Flexion, extension. Okay. Now, the other important thing is that in the tibia we have these two condyles. Okay, in between these two condyles we have this bony protrusion, bony prominence, which is called the intercondylar eminence. And this intercondylar eminence is important. It serves as an important attachment site for two important ligaments, which is the anterior cruciate and posterior cruciate ligaments, and we're going to look at that in a different model, because this is the attachments, serves attachment points for the important ligaments of the knee joint. Okay, so this is the intercondylar eminence of the tibia. Okay, and basically what happens is that, again, we have the posterior aspect of the femur. We have the intercondylar fossa of the femur, and again, this also serves the attachments of certain ligaments, which is the two important ligaments, like I said, the anterior cruciate and posterior cruciate ligaments. Okay, so let's look at this area a bit in a different model, and we're going to come to this a bit later. Again, let's look at the let's look at this. Let's look at the knee joint in terms of ligaments and the menisci. So this is basically the distal end of the femur and the proximal end of the tibia, and what we see here is basically the knee joint, the joint between the condyles of the femur and the condyles of the tibia, medial and lateral. So what do we see here? We see, first of all, ligaments. So this is the collateral ligaments. Collateral ligaments. So basically, this is okay. Let's look at the lateral. The lateral. Why do I know this is lateral? This is because the fibula is located on the lateral side. So we have the lateral collateral ligament. This is the lateral collateral ligament. It is also referred as fibular collateral ligament, or lateral collateral ligament of the knee joint, or basic just fibular collateral on the lateral side. Okay, so it connects the lateral epicondyle with the fibula beneath. All right, so basically it's stabilized on the lateral side. This knee joint is stabilized with this collateral ligament on the lateral side. On the medial side, we see again another collateral ligament. This is called the tibial collateral ligament. Okay, so also referred to as the medial collateral ligament. All right, or medial collateral ligament of the knee joint. Again, it connects the femur to the tibia. On the femur, it's the medial epicondyle. It connects the medial epicondyle and to the medial aspect of the tibia. So this is the medial collateral ligament, one of the important ligaments of the knee joint. Two important ligaments. Another important ligament, as you can see here, is the anterior cruciate. So we have two cruciate ligaments, and the anterior cruciate and posterior cruciate. The reason why they are referred as cruciate is that they cross. Okay, then they make a cross. Crucifixion. Okay, the reason why, so they make a cross direction an attachment, and that's why they call it cruciate. So we have anterior and posterior. Okay, so the anterior cruciate ligaments, how it goes is like this. So this is the okay. So look, this is the tibia, right? Okay, this is the front. So this is the front of the tibia, this is the back. So this is the intercondylar eminence here. So anterior cruciate ligament attaches from the anterior side of this ligament. So we have the medial tubercle, lateral tubercle. We're going to look at that in tibia. So in terms of this anterior intercondylar eminence of the tibia, so anterior cruciate basically attaches on the anterior side, and the posterior cruciate ligaments attached on the posterior side of the tibia. So this basically anterior and posterior terminology basically comes from the origin or attachment point on the tibia. So anterior part of the tibia is anterior cruciate. The posterior attachment of the posterior cruciate is attached to the posterior side of the intercondylar eminence, so the posterior side of the tibia. So how it goes from here is anterior cruciate goes backwards, all right, and attaches to the lateral wall of the fossa, but where? To the lateral condyle, all right. So let's look at over here. So basically this is the medial condyle, okay. So anterior cruciate comes from the tibia and attaches to the lateral condyle. Okay, so this is the wall. This is basically the wall of the lateral condyle here. So anterior cruciate attaches to the lateral wall, or the medial wall of the lateral condyle. Let's just to not get confused. So let's say that this is the wall of the lateral condyle. So anterior cruciate attaches to the wall of the lateral condyle, and the posterior cruciate ligament comes from the posterior side of the tibia and attaches to the medial wall. Medial wall of the attached to the medial condyle, the wall of the medial condyle. So anterior cruciate attached to the wall of the lateral condyle, posterior cruciate attached to the wall of the medial condyle. So anterior is laterally attached, posterior is medially attached to the condyle. I don't know if you get that. So if you look at this, basically, so anterior cruciate is over here. So as you can see, this anterior cruciate ligament is originated from the anterior part of the tibia, and then crosses to the lateral condyle. So this is the lateral condyle, okay. It goes to the intercondylar fossa, to the wall of the lateral condyle, attaches to that particular area. And this is the posterior cruciate ligament. So this comes from the posterior aspect of the tibia, and then goes to the medial condyle. So this is the medial condyle, as you can see, right? This is the lateral condyle. Why? Because the fibula is on this side. So this is lateral condyle, this is the medial condyle. So on the posterior side, it comes and attaches to the medial side of the intercondylar fossa of the medial condyle. So this is the anterior cruciate and posterior cruciate. So what's the function of these anterior and posterior cruciate? Basically, it holds the joint together, and it stabilizes the tibia and fibula on together. So, and it prevents the dislocation or movement of the tibia anteriorly. The posterior cruciate prevents the movement of sliding motion of the tibia backwards. So posterior cruciate ligaments prevents movement of the tibia backwards, and anterior cruciate ligament prevents the movement of the tibia on the femur anteriorly. So basically, you have the prevention of the excess amount of movement of the tibia on the femur, both anteriorly and posteriorly. So this is prevented by the anterior and posterior cruciate ligaments. So what happens when, and then you would have okay, let me look at the other side, and let me give you some clinical notes. Let me explain and talk about the menisci now. And then we have in the knee joint we have two meniscus. Okay, we have the medial meniscus and lateral meniscus. This is the number 13. I don't know if you can differentiate or focus on this. This is the medial meniscus, and this is the lateral meniscus. These menisci basically are located out of fibrocartilaginous structures. Okay, and basically these are crescent shaped, and it is also referred to as semilunar cartilage or semilunar structures, which is like a half moon shaped, crescent shaped or C-shaped structures the medial meniscus and lateral meniscus, and it's located on the lateral condyle and the medial condyle of the tibia. Okay, and the function of these menisci is basically it's shock absorbers. It acts like a shock absorbers, like a cushion. It acts like a cushion, and it absorbs the excess amount of weight, and that's a really important function of. And it also has other functions too, but the main function of the menisci is referred to as being a shock absorber structures, medial meniscus and lateral meniscus. Okay, so. Okay, let me give you some clinical points here. So since these fibrocartilaginous structures like the meniscus, since they don't have a blood vasculature, because they are avascular structures, they are supplied by the adjacent blood vessels or adjacent nutrients, and therefore when they get teared or after certain age, when it's wear and teared, when their structure are deformed, when deformation occurs, it is very difficult for them to heal or renew, and therefore they have to be repaired or just go under arthroscopic surgery, and they will be cut or dissected and then brought out of this area, and so this is like meniscus surgery. One of the other thing is important here is that in the medial side we have the medial collateral ligaments. We have the superficial and deep part of the medial collateral ligament, and the deep part portion of the medial collateral ligament is attached to the medial meniscus. So in terms of like sudden rotational movement, if there's a sudden rotational movement, you can break certain things here. One, the medial collateral ligament can be torn, and when this medial collateral ligament gets torn, it can also stretch and tear the medial meniscus. So one thing that we see is torn medial collateral ligament. Second, along with this, it also pulls the medial meniscus, and it also destroys the medial meniscus too. That's second. And third, in that this motion, this abnormal motion of the person, it can also tear the anterior cruciate ligament. So we have three disorders at the same time: medial collateral ligament, we have the degeneration of the medial meniscus, and we have the tearing of the anterior cruciate ligament. And these basically are referred to as unhappy triad. It is also referred to as unhappy triad, don't forget that. So this is a clinical note for you to remember. So basically, anterior cruciate ligament, we call them as ACL, and the posterior cruciate ligament we refer to as just like as PCL. So we have a ACL torn or PCL torn, or we have a torn of the medial meniscus or lateral meniscus, or we have the torn of the breakage of the collateral ligaments. Okay, so that's and we have a ligament that connects the menisci to. This is the transverse ligament of the knee joint. Okay, here, and then we have another ligament here that connects the meniscus to the femur. We have the posterior meniscofemoral ligament here, and this basically these ligaments is the transverse ligament on the front, and the transverse and the posterior meniscofemoral ligament at the back basically stabilizes this knee joint together. Okay, one last thing that I want you to remember is this guy here. So we have the patella. As it is here, this is the patella. So we have the base of the patella, as you can see. All right, this is the base of the patella, and this is the apex. So it's like a triangular shaped bone here, and this bone is basically is referred to as sesamoid bone. Why? Because it's located inside a tendon of the quadriceps. So the quadriceps muscle. Let me see here. Okay. Can we look at over here, if we can, please? Yeah. So this is the quadriceps muscle, and basically this is the patella, all right? So this quadriceps, we have vas medialis, vas lateralis, vas intermedius, and then rectus femoris. So all these muscles come together, they form the quadriceps, and they come together, they form the tendon of the quadriceps, as you can see, and they cover or grasp this bone here, what we call as patella, and from here we have the patellar ligament coming out from the bone and attaches to the tibia. All right. So what happens is that we have the quadriceps tendon over here, and then we have the patellar ligament over here. All right. And as you know, ligament attaches bone to bone, and the tendon attaches the muscle to the bone. So this is the quadriceps tendon, and this is the patellar ligament. All right. And beneath the patella, we have the patellar bursa. So we have the subpatellar bursa, and then we have the inferior patellar bursa that that is located between the skin and the tendon or the ligaments. And when these bursa, when there's an excess amount of motion between the skin and the tendon or the skin of the ligament, and basically this bursa gets inflamed, so you have the inflammation of these bursa, you have the bursitis, and especially like the person who cleans the floor and gets this bursa, the suprapatellar or infrapatellar bursa inflammation could occur. Okay. And on the lateral side, this knee joint is basically stabilized by this tensor fascia lata here, as you can see here. And then we have on the medial side, we have the pes anserinus, where you have the sartorius gracilis and semitendinous tendons come together. As you can see, this is called the pes anserinus, and formed by the sartorius gracilis and semitendinosus. Okay, this tendon, an attachment point, also stabilizes the knee joint on the medial side. And also we have the tensor fascia lata that forms by the muscles from the gluteus maximus and the other muscles at the top, and they come and basically they also stabilize the lateral aspect of the knee joint here. So they also gives a really strong attachment point and stabilizes the lateral part of the knee joint. So that's patella, basically. What else? Right, I think. Okay, I think I covered all of the things. So one thing that I missed here on the medial epicondyle here, I think it's over. Yeah, over here. So this is the medial epicondyle. We have the adductor tubercle here. I forgot to mention this. On the medial side, the medial epicondyle, just medial to that, this tubercle, we have a tubercle here, just above the medial epicondyle. This is called the adductor tubercle. And adductor tubercle is on the medial side, so we have the adductor magnus. Okay, so on the medial side, again. So they have the adductor magnus coming down and attaches to this tubercle here. So this is the tubercle of the adductor magnus on the medial side of the medial epicondyle, just next to the medial epicondyle. And lastly, on the lateral side, we have the groove for the popliteal tendon. So this is so we have the popliteal muscle in the popliteal fossa here, and then the tendon basically comes around here and forms a groove, and this groove is called the popliteal tendon. And that's about it, I think. Okay, so I covered a lot of things today. So why don't you go ahead and listen to these? Yeah, I'm sorry. Oops. So why don't you go ahead and listen and repeat all these things that I talked about. And if you have any questions, then I'll be around and I will answer your questions. Hope this video was useful to you guys, and we'll be together in our next episode of anatomy videos. So I think we have the tibia, fibula, and the foot in our next video. Thank you very much for listening, and goodbye for now. Bye.